If you're a new grad PT, or maybe you're about to be, this video will save you time, guide you to level up your clinical game, and help you curate a career that you're actually excited about. These are the principles and systems that I wish I was aware of when I started. Early in my career, I struggled with being efficient with documentation, embracing a growth mindset, and feeling pressure to specialize too quickly. So we'll break down these areas as well as how to find mentors and improve your communication skills. You don't and shouldn't have to do this alone. I had the fortunate experience of going through an orthopedic residency right out of PT school. It was an all-encompassing process, but the most beneficial part was being paired with a mentor for weekly co-treatment experiences, as well as monthly clinical and case assessments. A mentor will help you improve your critical thinking skills as well as your clinical reasoning. In this way, you fast track your coach's eye. You learn to spot subtle compensations and movement errors. You really begin to blend rehab and performance, knowing when to push versus when to pull back. You get exposed to return to play criterion, which gives you an evidence-based algorithm that provides experience and judgment on how to really frame your entire plan of care. And networking, right? Mentors can open doors for jobs, referrals, collabs. And when you want to find a mentor, a residency and fellowship is a structured option, typically governed by your federal and state regulation boards. But if this is unavailable or for whatever reason unappealing, begin to follow expert clinicians and researchers in the field. Most will offer structured mentorship across many weeks, many months, and they may allow you direct or even asynchronous access to their knowledge and their skills. A growth mindset means faster learning with less burnout and better outcomes. It can also help with adapting to new research, technology, communicating with more clarity, handling feedback with composure, and staying versatile throughout your career. So here's some ideas to build that growth mindset foundation. Reflect weekly. One thing you learned, one challenge, one improvement. Ask for feedback. Your peers, your colleagues, your mentors, early and often. Always ask why. Why did I have a result, or why did I not have a result? Read research in topics that you're interested in, and you can do this as a weekly task. One paper a week is fairly sustainable. Journals that put out high quality practical evidence include JOSPT, IJSPT, and the BJSM. You can even pick a topic and get alerts for these when journals release papers covering your topic of interest. Normalize your mistakes. Treating every win and mistake is a fuel for growth. Surround yourself with other learners, those who are interested in topics you are, as well as maybe different topics. Set micro goals. One of the micro goals I practice daily is to systemize my exercise selection. Simply put, if I'm selecting an exercise with imposed demands and I want specific adaptations, I want to be ready with a regression, a progression, and a lateralization or modification. Another micro goal I currently practice but didn't early on is consistently summarizing the plan of care with the patient. This includes, number one, what's going on? Where's your pain or dysfunction coming from, and what's causing it? Number two, what framework and protocol do we need to implement to address these? Number three, what are the expected outcomes of these techniques within these protocols? And how long do we expect it to take for them to take place? All of these questions can be assessed on a micro level, such as within a session, as well as macro across weeks and months of care. You can be the smartest PT in the room, but if you can't communicate clearly, it won't matter as much. So here's how to instantly improve your patient communication. Start with empathy. Relate to their situation even if it hasn't happened to you. Ask them to tell them what's going on in their own words with as much detail as they can. Use the teach-back method. Tell them, can you show me how you'd explain this scenario, this exercise, this situation to someone else? Try dropping the jargon. Use analogies as much as you can. For instance, your ACL is like a seatbelt. It stabilizes your knee during sudden stops. Try to mirror your patient's energy, whether this is their posture, their vibe, but make sure you're doing it professionally, always having that professional boundary. And check in often. Ask them, how do they feel? What area of the body are they feeling? And do they continue to understand the intention of what you're trying to teach them? And once again, end every session with a summary. In physical therapy, tough conversations are bound to happen. Pain, loss of function, these are emotionally charged experiences. Our patients will feel confusion and frustration all the way up to anxiety and depression. Challenging conversations around lack of progress or flare-ups the general support of the medical system, maybe some resistance to what you've prescribed, these will undoubtedly arise. So when these conversations do come up, take the time to journal what you'd like to say and how you'd like to say it ahead of time. This will help you find clarity and confidence. In addition to this brainstorming, what questions and concerns do you think your patient will have? And this will help you be ready for the various directions the conversation may go. But remember, it's not your responsibility to fix anyone, but it is our responsibility to provide evidence-based education and guidance, as well as the necessary resources for the patient to continue moving in a direction of healing and reconditioning. So let's be real. Documentation can be difficult, it can be soul-sucking, but it doesn't have to be. Finding and using a solid EMR system is a game changer. So you'll want to look for an EMR that offers these things. Efficiency. This includes templates, drop-down menus, autofill features that can save you time. Organization. Do you have all your evals, your notes, and your billing info in one place? Compliance with HIPAA, Medicare, state boards, insurance plans. Make sure you have an EMR that helps you keep on track with built-in prompts and reminders. Communication. Quick sharing with other providers in terms of notes, documents, files. This leads to better patient outcomes. Billing. Find an EMR that syncs with your billing software, making your reimbursements smoother. Outcome tracking. This is great for both patient motivation and insurance justification. And finally, does it have remote access? When it's cloud-based, you can document at home, or you can actually perform telehealth if that's available to you. We'd like to take a quick break to introduce the sponsor of today's video, Jane, a clinical management software and EMR that has completely changed the way we run our practice at Prehab PT. So if you're a physical therapist or any healthcare professional managing appointments, charting, and billing, you know how much time admin work can steal from your day. And we love how it keeps everything streamlined, intuitive, and stress-free. Switching EMRs can feel intimidating, but Jane makes it easy with onboarding resources and 10 out of 10 customer support to help with anything you need. Use code PREHABGUYS for a 1-month grace period on your new Jane account. Click the link below in the description to get started. And last, everyone wants to specialize as soon as possible, but where's the real magic? It comes from being solid across the board. Why? You're gonna build clinical confidence, you're gonna learn to spot red flags and subtle movement patterns in all sorts of demographics and all sorts of scenarios. You're gonna learn to communicate with all different populations. You'll stay flexible in your career, seeing what you like, what you're good at, what you're not good at, what you don't like. And when you do specialize, you'll be able to do it with a foundation of wisdom, knowledge, and skills. All right, so let's summarize. Number 1, find a mentor who helps you sharpen your critical thinking skills and your clinical reasoning. Number 2, build a sustainable growth mindset. Number 3, master clear and confident communication. Number 4, let's get efficient with your EMR. And number 5, become a solid generalist before you specialize. You don't need to be perfect right now, but you do need to be curious, consistent, and coachable. So that's it for today. Hopefully you learned something and you can take something forward, and congratulations on beginning your physical therapy career.